Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about the Heart Smart Plan. These are dietary supplements that will help your heart recover. Now, many of you watching today have heart disease or cardiovascular disease of some type, and you call and ask, what can I do to help with the chest pain, the shortness of breath, the edema that collects down around my legs? That's what we're talking about. This plan will help many of you regain your health and make your life better. Reduce your pain, your shortness of breath, and on and on. This one is very important for all of us suffering from cardiovascular disease. Please stay tuned for that. But first, let's go to our news. Let's see what's happening in the health world. Adults who observe 5 key lifestyle patterns are much less likely to develop heart failure. Heart failure is a condition where the heart cannot respond to increased physical demands. It is one of the most common reasons seniors are admitted to a hospital. Researchers from Tufts University followed nearly 4,500 adults 65 years and older for up to 21 years. During the study, 1,380 cases of heart failure occurred. They found practicing at least 4 of 5 key lifestyle patterns reduced heart failure risk by 50%. The lifestyle traits are walking briskly, engaging in moderate physical activity during leisure time, not smoking, drinking alcohol only modestly, and keeping weight down to avoid obesity. The study was published by the Journal of the American College of Cardiology. Well, folks, here's another example that shows you do have the power to help avoid disease, and if disease strikes, you also have the power to modify its course and reduce its pain. Practicing basic healthy lifestyle traits greatly reduces your risk of developing heart failure. Heart failure is not the same as having a heart attack. It is not when the heart stops beating either. Heart failure is when the heart can no longer respond to increased demands placed upon it. Now, for example, when we are sitting in a chair or lying in bed, our hearts only need to beat slowly and without much force. But if we were to get up from that chair and walk at a brisk pace, the heart must both increase its rate of beating and the pumping force of each beat. When the heart cannot respond to increased demands like this, we call it heart failure, and it is among the most common reasons seniors are admitted to the hospital. And it is the most expensive disease that strikes seniors. The lifestyle traits that reduce heart failure risk are being able to walk at a brisk pace of at least 2 miles per hour, and doing so regularly, of course, including modest physical activity during leisure time, not smoking, drinking only occasionally, and keeping your weight down to or near your ideal weight. Researchers from McMaster University have proven for the first time intestinal bacteria play a pivotal role in developing the symptoms of stress and anxiety. The researchers exposed baby mice to repetitive stress by separating them from their mothers for 3 hours daily over the course of almost 3 weeks. The baby mice showed stress behaviors as expected. They also developed elevated levels of the stress hormone cortisol and altered intestinal function induced by elevated levels of the neurotransmitter acetylcholine. Now, all of this was expected. They repeated the study, but this time the baby mice had a sterile intestinal tract free of all bacteria. When these baby mice were exposed to stress, they also developed the same hormonal changes, but they did not display any stress-associated behaviors. Next, the researchers introduced normal intestinal bacteria into the stressed baby mice. Within just a few days, the baby mice began to display stress behaviors. This proves that intestinal bacteria play a pivotal role in inducing stress and anxiety behaviors. Well, folks, I apologize for the technical and complex nature of this report, but its findings provide tremendous healing power for those battling disease, accompanied by stress, anxiety, and depression. What we have learned is that our intestinal bacteria play a critical and essential role in inducing the symptoms of stress, anxiety, depression, and the social withdrawal that often accompanies chronic inflammatory disease. Now, you may be saying, this information was learned from an animal study, not human studies, so we can't trust its conclusions. To that I say studies like these can never be performed on innocent human babies. It could damage them beyond repair. So this is probably the best science we will ever have. Also, my experience confirms good health begins and ends in the intestinal tract. My greatest source of disappointment along this line of research is that 95% of all our psychiatrists and those who care for the mental health of America will never read or hear of research like this. High-dose vitamin D may lessen the risk of heart attack in patients admitted to intensive care units. Researchers from Grady Hospital in Atlanta, Georgia, followed 565 successive patients admitted into the surgical intensive care unit. Half the patients received 50,000 units of vitamin D weekly, and the other half received 50,000 units every day while in critical care. The differences in outcome, well, they were dramatic. Those who received 50,000 units weekly spent 36 days on average in ICU, while those who received 50,000 units daily spent only 8. The 50,000 weekly group experienced 22 heart attacks, while the 50,000 daily group experienced only 11 heart attacks, a 50% reduction. But perhaps the most dramatic effect of high-dose vitamin D was its cost savings. Those lower-dose vitamin D, they spent $139,000, while those on high dose spent only $32,000 on average. Wow. Isn't that amazing? This is truly an amazing landmark and breakthrough study. When high-dose vitamin D, 50,000 international units are given daily versus 50,000 weekly, which is considered by many a high dose. 50,000 units a day, it reduces dramatically the rate of heart attacks, time spent in the ICU, and total money spent on ICU care. Heart attack rates were reduced by 50%, time spent in ICU reduced from 36 days to just 8, and the money spent on care was reduced from a whopping $139,000 to a much more affordable $32,000. Well, of course, this study will need to be repeated probably several times before it becomes standard of care, and I truly hope these follow-up studies are honest and sincere. But this study already sends a loud and clear message that when we are under the extreme stress of major traumatic illness or surgical interventions, our bodies need extremely high levels of vitamin D to assist in our healing. This is a fascinating subject, and we will keep you informed as the information comes in. I promise you that one. Well, today on Your Health, we will discuss the essential role that CoQ10 and the other components of the HeartSmart plays in good health. Stay tuned. We'll learn together.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media, we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. CoQ10 and L-Carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-Carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-Carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Welcome back, everyone. It's great to be with you today. We have a great show planned for you today. We're going to be talking all about the heart. Isn't that a great topic? We'll be talking about CoQ10 and L-Carnitine and how this amazing combination of nutrients really helps support a healthy heart, as well as many other things in our body. And then we're going to go into the Heart Smart plan. So we are going to have a healthy heart after today. So Richard, where do you want to start on this fantastic subject?
Well, let's start with the reason why we're suffering from symptoms of cardiovascular disease. You know, shortness of breath, that type of thing, chest pain, angina or chest pain when you exert yourself, fluid retention, edema, muscle pain with ambulation. By the time you get to the mailbox, your calves and your thighs are aching. You have to take a rest just to get back to the house. The fatigue and the poor sleep, all of these are symptoms of cardiovascular disease and more. And they occur because your body is not supplying enough energy to the cardiovascular system. The heart doesn't get enough ATP to do what it has to do. It becomes ischemic, lack of oxygen, and this leads to the pain you're suffering from. Now, medications approved and used for cardiovascular disease do nothing to improve the ATP production. The dietary supplements, the CoQ10, the L-Carnitine, D-Ribose, magnesium, what we're going to talk about today, they do. They help provide energy to an energy-starved cardiovascular system, relieving many of the symptoms that you're experiencing with your cardiovascular disease. Now, I'm not saying for you to stop your medicines. They play an important role. We've got to keep the blood pressure down. We've got to keep the fluids off, all those things. But I think you're going to find if you embrace this Heart Smart plan, you're going to have fewer symptoms and you'll need fewer medications to control your condition. So keep an open mind. Let's look at the evidence, then we decide what we do. All right, let's start with coenzyme Q10, ubiquinone. I'm starting with this one because most of you have heard of this. Well, what is it? Another word for it is ubiquinone, and it comes from the word ubiquitous because it's found in virtually every living thing ever analyzed. All God's creatures have ubiquinone in it. It's a very unique molecule. It was first isolated over 50 years ago at the University of Wisconsin. Frederick Crane did this unbelievable work, and he won a Nobel Prize for it. It was that important. It plays a critical role in the conversion of glucose to ATP and cellular energy via the electron transport chain of aerobic respiration in the mitochondria. All of this is in the mitochondria. Each cell can have thousands of mitochondria, especially in the heart where it's constantly working. And these mitochondria take glucose and fatty acids, lipids in our diet, and it converts it to cellular energy so the heart can do what it needs to do. And CoQ10 is part of that. It also acts as a vital antioxidant. It prevents the oxidation of LDL cholesterol so you don't get the plaque so bad in your arteries. And CoQ10 is primarily made by biosynthesis. We make our own. You can get some from foods, but it's not enough to sustain life. We have to be able to make it. And its source is primarily made by biosynthesis. It is a complex 12-gene, 17-step pathway requiring at least 7 vitamins and several trace elements. By its very nature, CoQ10 production is susceptible. Low production is common, and accepted normals are suboptimal. Did you get that? We are susceptible to low CoQ10 levels because to make it for ourselves, it's exceedingly complex. It requires multiple nutrients, and medicines frequently affect it. Disease affects its production. So by its very nature, we're susceptible to low CoQ10 levels. When CoQ10 levels are low, the symptoms of heart disease emerge. Chest pain, shortness of breath, dyspnea, can't get my breath, air hunger, dyspnea with exertion, fluid accumulation, body aches, fatigue, depression even comes on. High energy organs have the most CoQ10, the brain, the heart, muscles, you know, things that require the most energy to do what they do need the most CoQ10 so you have the energy to do it. Here's one of our major problems that we're facing today. Statin cholesterol-lowering drugs. This is your Lipitor, Zocor, Crestor class. The statin drugs that lower cholesterol, beta blockers used after heart attack to protect you from a second heart attack and to control blood pressure. Sulfonylureas for diabetes to keep your blood sugars level down so you're not highly susceptible to a heart attack. Thiazide diuretics, the most commonly prescribed antihypertensive in America, and other medicines, age and disease, all lower CoQ10 levels. The very medicines cardiologists prescribe to control your heart condition can deplete your CoQ10 levels, making your condition worse. This happens every day, every minute, every hour of the day in the United States. And fortunately, through the efforts of forward-thinking people like Dr. Steven Sinatra and Dr. Langshand and others, we now know more about CoQ10, and we're helping so many people with CoQ10. And I want to help you. I got to help you understand, if you have a heart condition, you really should be on CoQ10. All right? Now, let's go to the research. Don't take my word for it. What do the experts say? If you have angina and you take CoQ10, multiple studies now have shown you'll have less chest pain, less medication use, fewer hospitalizations, and you'll have better performance on your stress test. What's the heart doctor do every time you go in for, let's get on the treadmill, let's see how you do when we put a little load on your heart, Mrs. Jones. Get on up there and let's start walking. And after a couple of minutes, I got to stop. You know the drill, you know how it works. And this is how the doctor tells whether they need to intervene, what's your status, you know. If you take your CoQ10, you'll be able to walk further. And wouldn't it be wonderful the doctor says, you know, you did 20% better this time than last year? What, are you doing something different? And you go, yep, I'm taking CoQ10. And he'll say, you know, I've heard that story before. You keep doing what you're doing because it's helping you. How many times have we heard that? Thousands of times. Next, mitral valve disease. You will have fewer irregular beats, you'll have better exercise tolerance and less fatigue, mitral valve disease. And this is true of virtually all the valvular diseases of the heart because the heart has to work harder. There's backflow. The heart has to repeat the pumping. As part of that blood, it has to be repeated in the pumping process, and it puts extra demand on the heart, and it needs more energy to do that. If it has CoQ10 in abundance, it is better able to achieve that effect. Coronary artery bypass grafting. You had a bypass for your heart. Maybe you had angina. Maybe you had a heart attack, and they're trying to go past the obstruction in the arteries. 3 out of 4 patients, if they take CoQ10 prior to this surgery, have lower glucose levels, which means you'll heal better, faster, fewer arrhythmias, fewer irregular heartbeats, less medication in the recovery, less drainage from surgical wounds, fewer blood products, which is always a good thing, and a shorter hospital stay. Other than that, there's no value. Can you believe this? That's enough right there. Coronary artery, 400,000 of these are done every year. 400,000 in this country alone. The forward-thinking cardiologists are making it a part of the routine, and throughout the rest of the world, it's already happening. We're a little behind on that, but I hope that changes. What about cardiomyopathy, heart murmurs, valve disease? Improved ejection fraction, meaning the heart more efficiently pumps out more blood per pump. It doesn't have to repeat and recycle, doing more blood with each pump. It's not coming back into the heart and have to redo it. You see what I'm saying? I'm not explaining it very well, but the ejection fraction, the amount of blood that goes out and stays out with each beat, improves. Improved diastolic function, in other words, the heart pulls blood back. See, it takes more energy to pull blood back into the heart than push it out. And so in heart failure, fluids accumulate in the periphery because the heart can't siphon it back. It loses energy to do that because that's the hardest part of its job. With CoQ10, that effect is more efficient, and it draws the fluids back so you don't accumulate the edema quite so bad. Lungs and in the legs, this type of thing. You know, that edema really stresses the system, and CoQ10 helps to reduce that. Less hypoxia, if combined with selenium, reduces the risk of death. A big study just came in. Elderly men who take CoQ10 each day and selenium, they live 4 years longer on average. Did you get that? Elderly individuals, this was in men, but I don't know why it wouldn't help women. Elderly men who are highly susceptible to heart failure, the #1 most expensive diagnosis in America for the seniors. If they take CoQ10 and selenium, they live 4 years longer. And this is quality life. This is not a vegetable in a bed somebody has to take care of you. You know, this is quality life. 4 extra years from just CoQ10 and selenium. That's worth doing. Now we have a few more on CoQ10, so we'll finish those after these important messages.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe 2 of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, talking about CoQ10 and a healthy heart. This is so amazing. So, Richard, you've got a study on heart failure in CoQ10.
Yeah, we have, there have been dozens and dozens of studies of CoQ10 on heart failure. And we just mentioned the study of elderly men. CoQ10 with selenium increases life expectancy 4 years. This is what they experienced. It's just quite remarkable. And they were from the perspective of heart failure associated deaths. Walk further with CoQ10 if you have heart failure, exercise longer, reduce disability rating with CoQ10 and heart failure, better stress test performance, improved blood pressure, and endothelial dysfunction. Endothelial dysfunction, the endothelium is the inner lining of the artery. It's the brain center, and it decides whether the artery is constricted or open and flowing. And when you have endothelial dysfunction, it can't decide what to do. And if you don't have good blood flow to an organ, that organ is not going to function properly. You don't need to be a scientist to understand that. Blood flow, that rule reigns supreme. You've got to have it. And endothelial dysfunction is a major part of cardiovascular disease. With time, it reduces the enlarged heart size. CoQ10 reduces heart size in heart failure. It improves the ejection fraction, how much blood is being pumped out, less shortness of breath, less pain, while quality of life improves. Heart failure is the condition that CoQ10 gained its reputation on. And then doctors decide, well, let's try it for some other things too. So CoQ10 is big in heart failure. Next, hypertension. Multiple double-blind placebo-controlled trials show that CoQ10 reduces systolic pressure by about 11 points and diastolic by about 7 points. There's a chance that you won't need your blood pressure pills anymore if you take CoQ10. And that remains to be seen. You have to find out. But wouldn't you rather take a nutrient than a medicine to control blood pressure? I absolutely would. Don't forget your vitamin D with that. That'll help too. Atherosclerosis, arterial sclerosis, hardening of the arteries, blockage of the arteries. CoQ10 softens the artery over time, and it improves that endothelial function so the artery knows whether to open or close. It has to do both for proper function. It knows better how to do it. Stress-induced cardiovascular disease. Here's a study. CoQ10, when combined with garlic, reduced stress-induced cardiovascular disease by 75%. Remarkable. It lowers the artery calcium, that hardening of the artery, less inflammation and lower blood pressure. Healthy patients, exercise tolerant. You're in good shape, but you want to exercise more. Maybe you're a young person, maybe you are a senior and you want to plant a garden this year and you want to be a little more active. If you take the CoQ10 before you do it, no heart disease, you will perform better and you'll recover quicker after that strenuous activity is over. That's a true benefit. Healthy patients taking a statin drug for cholesterol. Statin drugs inhibit the manufacture of CoQ10 just like it does cholesterol. And we have a nation of depleted CoQ10 patients who they're taking these statin drugs to lower cholesterol. So multiple studies have shown if you supplement CoQ10 with your statin drug, you can compensate for that and you're not left susceptible. You know, I've often wondered if statin drugs did not lower CoQ10, how much better they would be in the prevention of heart disease. I think it would be a dramatically better drug if they could figure out how to not lower CoQ10 with it. But until they do that, please take a CoQ10 supplement when you're taking Lipitor, Zocor, you know what they are. Please do that. You will benefit from it. Cholesterol, CoQ10 lowers LDL and it raises HDL by about 3%. It's enough that it's significant. It's not a large amount, but it's helpful. Diabetes. CoQ10 lowers oxidative stress and inflammation. It reduces blood pressure. It prevents elevated insulin levels. This insulin resistance of type 2 diabetes helps to reduce that. Improves artery and nerve function because all cells need CoQ10. That's how all cells get their energy to do its various functions. You know, one of the things cells do with CoQ10 is drive the healing mechanism. And this is what we see fail first. The nerves and diabetes. It can't heal from the daily insults of high sugar levels and whatnot, and you get the diabetic neuropathy. So fuel the healing mechanism, the detoxification mechanisms in our cells. We do that with CoQ10. It provides energy for all the cellular functions. That's important to understand. It helps you understand the benefits of CoQ10. The brain and the nerves also benefit. CoQ10 protects the brain. It activates neural stem cells. We can replace brain cells, but it's a very slow process, just like replacing heart cells. CoQ10, they found, activates the neural stem cells to help replace anything you lose from tiny little infarcts. This is a common part of aging. It's a reason why we lose our ability to think with age. And we replace those brain cells, we're far ahead with that problem. It reduces slowing the progress of Alzheimer's. It slows the progress of Parkinson's and other neurodegenerative disease. Now, it doesn't cure them. I'm not saying that. But anything that we can do to slow it down, add your curcumin with that, your fish oil, vitamin E, and vitamin C. You're going to take steps to keep your brain sharp. CoQ10 is instrumental in that entire process. Eyes and ears reduces the damage of glaucoma, slows cataract formation, even protects and reverses noise hearing loss. You know, maybe you're a carpenter. Get on the CoQ10. curcumin and other nutrients for the ears, for the nerves, like alpha-lipoic acid, B12 and zinc, this type of thing. And you can restore some of it. Miscellaneous. Combined with the Mediterranean diet, CoQ10 lowers inflammation, improves bladder function and prostate enlargement, lowers the PSA in healthy individuals, protects the diabetic kidney, helps to improve male fertility, improves saliva flow in the dry mouth, dry eye syndrome called Sjögren's syndrome. That's really important. If you've never struggled with dry eyes and dry mouth, you have no idea the disability it creates for you. CoQ10 helps to improve that. When combined with curcumin, CoQ10 with curcumin, it stops bone loss, plays a role. See, all cells need the CoQ10 for metabolism. This is amazing. So it has a role in osteoporosis. Side effects? None, unless you take huge doses, and none of you need that level of dose. Folks, we have a break. When we return, we're going to talk about L-Carnitine, the helper to CoQ10, when we return.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. We're back, everyone, having a great discussion on CoQ10 and a healthy heart. This is just amazing information. But before we continue, I want to let you know about the May Savings Celebration at BioInnovations. Great prices, best prices of the season, and free shipping on orders over $50 in the mainland USA. So this is a good time to get the CoQ10 and that Heart Smart plan so you can have a healthy heart. So, Richard, before we go on to L-Carnitine, let's let everyone know quickly how you take CoQ10 and what the milligram dosage that they should look for.
You will find doses of CoQ10 as low as 5 milligrams a day all the way up to 1,200. 5 is so small that it probably wouldn't help the majority who are truly in need of CoQ10 supplementation. It can take up to 2 weeks to get your CoQ10 level up to where it's helpful, so I would recommend a higher dose. 90 milligrams, maybe even 200, 300 for a few days to get your blood level up, and then reduce it to the least amount to give you the benefits you need, because we want this to be cost effective. Also, the reduced form of CoQ10 works better, it absorbs better. And certain preparations, such as ours, you absorb up to 300% more of it, which, it just makes it more cost effective. That way, a 30 milligram gel cap is enough. It equals a 90 of somebody else's. This is what it's got to get into your system. The reduced form and the formulas that absorb very well, that's the hallmark of quality. That's what you want. It keeps the cost down in the long run. Now, let's talk about L-Carnitine. We come to understand that CoQ10 helps to turn glucose into cellular energy, ATP. Well, L-Carnitine is an amino acid that turns fatty acids, the lipids in the oils in our diet, into ATP energy for the heart. So you have this synergy. CoQ10, the glucose, L-Carnitine, the fatty acids. And this is important because 60% of the cardiovascular energy demand comes from, it's supplied by fatty acids. And I always worry about people who have slightly elevated triglyceride levels. That's what we're talking about. And they're doing all these desperate steps to drive it way down to under 100. Don't do that, because your heart needs that for energy. The majority of the energy supplied to the heart comes from these triglycerides. If it's too low, you're going to starve your heart. It's not a good thing to do. So L-Carnitine improves that energy flow from the triglycerides. Myocardial infarction. What happens when we add L-Carnitine to our supplement plan? Myocardial infarctions, it reduces mortality from a heart attack. It reduces the infarct size. It's not as big of a heart attack. It improves the ejection fraction again. Again, when the heart has the energy it needs, even if it's been struck with a disease, it's going to perform better when it has its energy. Just makes sense. You're less likely to suffer a second heart attack. You'll have less chest pain, fewer arrhythmias of the heart, better exercise tolerance, and lower heart failure, decompensation, and complications. So it improves just like, and you're getting not only the glucose pathway, but also the triglyceride pathway. What about atherosclerosis? This is the one condition, claudication, that brought L-Carnitine to the forefront. CoQ10, it's heart failure. L-Carnitine, it's claudication. In other words, what this is, you have stricture in, for example, your leg arteries. And so as you walk to the grocery store, your car, whatever, you can't keep up with the demand in your heart, can't get the blood flow to your legs, and it starts to scream ischemia. Same thing that happens in the heart with angina, but it's happening in your legs. It's called claudication. They've been able to show that if you take the L-Carnitine in claudication, your walking distance free of pain increases anywhere from 23 meters to 123 meters. This is dramatic. This is back to the mailbox and back without pain. This is what I'm looking for. Maybe if I get a close spot at the grocery store, I can get in and get a few things now where I couldn't do that before. And the maximum walking distance before you just say, I've had enough. I can't do any more, increases anywhere from 9 to 100 meters more. That's 100 meters. That's 100 meters. That's like 108 yards. Just think yards. This is enough to improve quality of life. In heart failure, the same thing, improves walking distance. Your cholesterol and triglyceride levels. Since the triglycerides were augmenting their flow into the heart for energy, when we take L-Carnitine, if you have high triglyceride levels, it'll help to bring it down. This is a better way to manage triglycerides than drugs. And we need those oils in our diet. The olive oil and all these things, these are good for us. So it really helps with our cholesterol and lipid management. And one of the new findings is L-Carnitine really helps to lower LPA, lipoprotein A levels. It is the most accurate predictor of heart attack. It's not the cholesterol, it's not the LDL, it's the LPA is the most accurate predictor. The higher that LPA, the more likely you're to have a heart attack. And L-Carnitine lowers LPA levels. This is tremendous without side effects. Dialysis patients. L-Carnitine with CoQ10 lowers the LPA in dialysis. Dialysis patients, renal dialysis, are very susceptible to increased heart attack risk. CoQ10 and L-Carnitine will help the renal dialysis patients. Multiple studies. It lowers the inflammatory profile in the kidney, and it lowers the oxidant stress, the free radicals in the kidney, which is a real problem in renal dialysis and chronic kidney disease. Diabetes improves glucose tolerance. We've talked about that. Asthma deficiency is common in asthmatic children. Replacing it improves asthma scores. Autism, there's some benefit for the autism patient. Erectile dysfunction, L-Carnitine, arginine, and niacin improves erectile dysfunction in almost 80% of the men who try this. I'll repeat it: L-Carnitine, arginine, and niacin, vitamin B3. Arginine is an amino acid. Natural approaches to erectile dysfunction. Aging. Double-blind study of 66 100-year-olds, reduced, 100-year-olds. Give them L-Carnitine, it reduced total fat mass, increased muscle mass, increased the capacity for physical and cognitive activity by reducing fatigue. It helps even elderly people who just don't feel well or they want to do a little better. So, you know, the point of this, it's never too late. It's never too late. Dosage anywhere from 250 to 2,500 milligrams a day. If you're on seizure medicine, you'll need more because you clear out more L-Carnitine that way. The complements CoQ10 beautifully. Let's go to our break. When we return, let's talk about D-Ribose. This is a sugar that we don't use to raise our blood glucose, so it's safe for everyone to take, but we make ATP out of it. We'll have that when we return. CoQ10 and L-Carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
Bioinnovations brings you Dr. Becker's Bionutrients CoQ10 with L-Carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-Carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Here is our hope for you today. I'm Cindy Becker. Do you feel that you'll never really be joyful and happy in your life? The Reverend Billy Graham wrote about these two emotions, joy and happiness. Dr. Graham says, joy is not the same as happiness, although they may overlap. Happiness depends on circumstances. Joy depends on God. In Psalm 30, David, whose life seemed an endless battle, experienced joy despite his problems as king of Israel. David wrote, "You turned my wailing into dancing. You removed my sackcloth and clothed me with joy, that my heart may sing to you and not be silent." If you are struggling to find joy in your life, pray to God. Count your blessings. Joy depends on God. I'm Cindy Becker. This is our hope for you today. May Savings Time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at Bioinnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. We're back, everyone. Just a quick reminder before we go on with our talk. It is May Savings Celebration at BioInnovations. Great prices. I mean, really great prices. Good celebration we're having. And free shipping on orders over $50 in the mainland U.S., so don't miss it. So, Richard, this is interesting. We did a lot on CoQ10 L-Carnitine, and we have a good understanding of that now. So now to move on into the HeartSmart plan, let's talk about D-Ribose.
D-Ribose is a 5-carbon sugar, glucose is a 6, so it's a little different, that becomes part of the ATP molecule. The addition of this 5-carbon sugar, this D-Ribose, to ATP is one of the rate-limiting steps to the production of ATP. What I mean by that is you can have all the L-Carnitine you need. You can have all the CoQ10 you need. Everything there is fine, but you don't have enough D-Ribose, you're still going to be compromised on your ATP because it's one of the rate-limiting steps to this production. So adding a little of this D-Ribose to your plan complements L-Carnitine and CoQ10. Multiple studies show improvements in fatigue, shortness of breath, chest pain, and exercise tolerance when taken alone, but it works best if we complement the CoQ10 and L-Carnitine. Now, please understand, if you take a scoop of D-Ribose and put it in your mouth, you go, oh, that's sugar, that tastes sweet. And, oh, I'm a diabetic, I can't have that. D-Ribose does not raise blood sugar levels. It's so special, the body dedicates it to the production of ATP, not to raising your glucose level. So this is a substance, say you'd like a little sweet in your iced tea or your coffee or whatnot, but you got to stay away from the sugar and you don't want those artificial sweeteners. Put a scoop of D-Ribose in there. It will be sweet, it won't raise your blood sugar, and it will help your body make ATP. Now that's a nice alternative sweetening agent. One thing, diabetics, if you take really large doses, 60 grams or more, which would be 12, 15 teaspoons a day or more, it could actually lower your blood sugar because your body thinks it's a sweetener and you don't want to eat anything else, and so it'll drop it. So, but that's only in diabetics who take large amounts. And it's helpful for fatigue. If you want to have chronic fatigue, add a little D-Ribose to your plan, and it will help with the chronic fatigue. Let's do magnesium real quick before the break. Magnesium is an essential mineral that's involved in at least 350 or more different metabolic enzymatic reactions. It's a cofactor. It is involved intimately in the production of ATP. Without magnesium, this cellular battery spark, as it were, magnesium, we are not good at making ATP. So CoQ10, L-Carnitine, D-Ribose, magnesium, they all work in unison to help make this ATP that drives the cardiovascular system to do all it needs. You know, that lowly heart, all day long, all night long, awake, asleep. It never gets a break except for a fraction of a second between beats. And it has to constantly supply energy. The arteries squeeze the blood on. They never take a break. If you don't have this constant supply of energy to these structures, you're going to suffer the symptoms of cardiovascular disease, and we can help with that. Adding magnesium to your plan will reduce blood pressure, improve chest pain, shortness of breath, calm painful muscles and joints, along with promoting restful sleep. We do a whole individual program on magnesium. Countries that have low magnesium groundwater have the highest rates of cardiovascular disease in the world. Countries that have high magnesium content in their water and their diet, they have the lowest rates of cardiovascular disease in the world. Here in America, the East has high magnesium. As you go west, the magnesium levels drop. You can live in the East and still be deficient in magnesium. Don't get me wrong, but that's the pattern. So if you live in the West, and I'm referring west of the Mississippi, it's highly likely that you're low on magnesium. It is widespread. It is one of the most common nutrient deficiencies we have, and it plays a role in our high cardiovascular disease numbers. There's no need for this to happen. We can supplement this magnesium. The recommended dosage of magnesium is 320 milligrams for a woman every day, 420 for a man, but the experts say we need more than that, especially if we have cardiovascular disease. Many will benefit from taking 500 milligrams a day, 750 milligrams, 1,000 milligrams a day or more, up to the point where it causes loose stool. You know, milk of magnesia is laxative. We don't want to get so much that it washes us out. So certainly 500, 750 is tolerated by most everybody. So that's your combination, except for one last one. Fish oil. How could we possibly overlook fish oil in the treatment and controlling and preventing cardiovascular disease? Well, we're not going to. We'll talk about it in our final segment when we return.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart, and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Just a very quick reminder about our May savings celebration at BioInnovations. Great prices and free shipping on orders over $50 in the mainland USA. Don't miss it. So, Richard, time is short, but we can't forget fish oil. We have so much research now on fish oil, and I recently did a review of the last 100 double-blind placebo-controlled trials conducted on the health benefits of EPA, DHA, and the components of fish oil. And we'll give you a quick summary. A lot of details here, but bear with me. Fish oil, the omega-3s, reduce triglycerides, reduce the risk of sudden death from cardiovascular disease. Each one of these is a study. Each and every single statement is a result of an extensive study. It delays cardiovascular disease death, benefits of fish oil now, reduces your heart attack risk, it reduces plasma viscosity, red blood cell rigidity, and systolic blood pressure, thereby reducing blood clot risk. They know how it works. It improves heart rate variability. Your heart should be able to change its pace of beating depending on your need. And heart rate variability is a measure of that. You want a good heart rate variability. And it does this at rest and while during a stress test. It improves the autonomic nervous system's control of the heart. You don't have to think about how fast your heart should beat, do you? But if your autonomic nervous system is out of condition and it doesn't have the fish oil, it doesn't control the heartbeat as well as it should. Fish oil helps to correct that. It's a very important function of fish oil, the omega-3s. It improves the risk of heart attack, after stent placement in high-risk patients, and they understand the mechanism, they identified it. It improves angina in cardiac syndrome X. Don't have time to explain it. Less angina in syndrome X. You have it. If you have it, you know about it. It improves the blood flow in that setting. It reduces oxidative stress in the heart. It lessens the risk of stress-induced heart attack. Then the mechanism was defined. The EPA content of fish oil reduces blood clots in men, and the DHA reduces blood clots in women. And they know how it does it by reducing platelet aggregation. It reduces the markers of inflammation known to predict high risk of sudden death due to MI. These are all the mechanisms of fish oil. It's amazing. It improves endothelial dysfunction in smokers. It improves cognitive performance. What's that got to do with the heart? If you're having a set of unusual circumstances, if your brain's working better, you're going to figure it out better. Yeah, the brain controls it all. The better it functions, the better everything functions. It reduces the risk of cardiovascular disease and diabetes, even in seniors. It's never too late to start a better lifestyle. Start supplementing now, seniors. It'll reduce your risk of heart disease and diabetes both. It improves heart rate variability in chronic heart failure. Review of double-blind placebo-controlled evidence. Omegas reduce the risk of fatal coronary heart disease and sudden cardiac death. It reduces cytokines and markers of oxidative stress while they lengthen white blood cell telomeres. Your repair mechanisms work better. Inflammation is a very big part of cardiovascular disease, and the white blood cells function more properly when you take fish oil. That's basically what that means. Reduces the risk of atrial fib after cardioversion. If vitamin E and C are added to fish oil, it reduces post-op risk of atrial fib. Long-term use improves gene expression of anti-inflammatory pathways. In post-MI patients, fish oil, in post-MI patients not taking statins, fish oils reduce the risk of second MI. There's a reason perhaps you can't take the statin drugs. If you get on the fish oil, you're going to reduce your risk, independent of taking the statins. Now, so when the evening news guy gets up and says, new big study, fish oil doesn't prevent heart disease, you're going to go, that's a bunch of malarkey, because I've heard the evidence. The truth is, you can design a study to discredit the benefits of breathing air. You know what I'm saying? You can't trust these statisticians sometimes. Sometimes they're being paid to come to conclusions. This is objective evidence. Please don't stop the fish oil when you hear that type of news, because it's not truthful. They're trying to sell you a drug. Take the power out of your hands. I want to put it back in your hands. CoQ10, L-Carnitine, magnesium, D-Ribose, and fish oil. That's the Heart Smart plan. It can work miracles, but you got to take it. You got to be proactive. It doesn't work sitting on the shelf. It's got to be part of your plan. Well, honey, this is such an important program. I hope I was eloquent enough to help you see the evidence. It's there. Make it a part of your daily regimen. It's going to make a difference. You're going to feel better. You're going to be more active. Thank you for your attention. We'll see you tomorrow, folks. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
Did you know not all bacteria is bad? Probiotics are healthy, beneficial bacteria which provide life-giving support for your intestines. Add foods like fermented cabbage, coconut, or miso that supports the good bacterial balance in your gut. Real foods like this boost your nutrient assimilation, plus you'll feel great. It's not crazy, just healthy.
Dr. Jennifer Epperson is chairperson of the NRB Radio Committee and a role model for other women seeking to enter media, but not before experiencing a major transformation in how she viewed herself through the lens of feminism.
Man-hater, feminism, pro-abortion. You realized it was self-loathing. You were depressed. And the moment